Okay, I think we're live.
We're live.
We're live. Hello, everyone.
Excellent. Hi, Ron.
Hello.
Hello.
How's it going?
Good. How you doing, Nathan? Hi, Kerri.
Hi,
Well,
Andre. Hi, Nathan.
welcome, everyone, and welcome to another episode, our second episode of Skintox. It's so good to be here. Before we start, I'd just like to send a big shout out to all the families that were affected last week and a half ago in the shootings. Our love and thoughts and prayers are with you all, and we're glad we postponed the show. It just wasn't the right time at that time. And a big hug from us to all of you, and we're wishing you all the best and lots of loves, hugs, and kisses. So look after yourself
Absolutely.
out there. Yeah.
Yeah.
So welcome everyone. Looks like we've got 3 viewers so far, guys. So that's pretty good.
Awesome.
So
Very good.
we'll get started. So tonight we're lucky to have Kerri from the Vibe Medi Spa in Halifax. Most people in the Halifax, Nova Scotia area know who Kerri is. How long have you been around the industry for now, Kerri? It seems a lifetime.
Well, yes, definitely. In aesthetics, gosh, for 25 years in Dartmouth and in Halifax. 25 years. Yeah.
Wow. So
I know. That's giving my age away. Yes.
You look amazing though, Kerri. I must say, and I'm so happy to have you on the show. Andre and I were talking about it today when we were preparing for the show. I love people that like to treat the skin very, very aggressively, and I know that's your approach. For those of you who don't know, we often use Kerri a lot around the country to do a lot of trainings and other clinics for us, and I personally love her approach, and Andrea loves her approach to the skin, and we're really looking forward to tonight because I think we're going to learn a lot from Kerri, and it's going to help a lot of patients and consumers out there to really help them manage their expectations and certain services that they're looking to do, and it's going to give them some ideas on some options that they'll be able to get into when we hopefully come out soon out of this isolation period, which I hope it's in maybe 2 or 3 weeks. Guys in Nova Scotia, it looks like. So hopefully that's the case. So tonight we're going to focus in 2 areas. We're going to focus on the skin. We're going to focus on products and services in the skin. And then secondly, we're going to focus on body contouring as well. And when we talk about these areas of medical aesthetics, we're going to talk about managing patient expectations, how you need to prepare for these services or products. And we're going to talk a little bit about pricing and why things are priced that way as well. So I'm going to let Andrea take over from here, and let's get going.
Okay, thank you. So Kerri, let's talk about some of the more aggressive techniques that you do and some of the treatments that you do. So I know there's something that we do or that you do at your clinic called photodynamic therapy, which I guess would be kind of more of a more intense type of treatment that you do. Can you speak a little bit about that and what that kind of entails and why you would do it?
Absolutely. Photodynamic therapy is a medical treatment because we're using a prescribed medication called Levulan, or on-label aminolevulonic acid. And what that targets is sun damage and precancerous skin cells in general, and keratoses. So it is basically used to seek out and destroy damaged cells from the sun. So we can actually eradicate those from the skin and replace them with new skin cells, so younger, more youthful skin cells. So it's kind of erasing damage that has been done over the years. It's such an interesting treatment because it will only destroy damaged cells. It leaves healthy skin cells intact. So it's a wonderful treatment that way. There is some downtime. So as you spoke to being an intensive treatment, we have to apply the medication, let it basically incubate, which we call it, for up a few hours. And then we would use basically photorejuvenation or light source, blue U, to basically activate the medication, and that will destroy the damaged skin cells. The skin is left looking quite red and sunburned for a few days, even up to a week. You have peeling involved, but it is quite a wonderful treatment to treat sun damage. And who doesn't have sun damage, like under the age of 30? So it's a wonderful treatment.
Yeah, and it can also help a little bit with acne as well, eh?
Definitely. So the medication, it seeks out inflammation also. So the sebaceous gland, where it's producing too much oil and it's too enlarged, the medication will sink into the sebaceous gland and affect that as well. So slow oil production, which gives you the result of having less acne, because without the excessive oil production, you shouldn't have the same amount of acneic breakouts.
Mm-hmm. So with downtime with a photodynamic therapy, you're looking typically 7 days.
Yes, so the next day you actually have to avoid light.
Mm-hmm.
So you have to stay in a lowly lit room, because the medicine will stay active in the skin for up to 24 hours or a little bit longer. So you're going to stay in a dimly lit room. You're going to then experience a sunburn type look to the skin. That is the damaged skin that has been affected. And then this body is going to shed that skin, basically like a sunburn. But that takes about 7 days, and depending on the amount of damage you have, will how the skin post treatment. I've had a treatment and I had a lot of sun damage because I didn't wear sunscreen as a child or a teenager, and I was in tanning beds until I was 18 years old. So my treatments were pretty intensive, and it was about a week. But then after 7 days, I looked fantastic. My skin was beautiful.
Mm-hmm. So say if you had a female that came to your clinic and she was, say, around 50, 55 years old, she's never really done much for her skin, so sun damage, but she doesn't want to go the injectable route. What would you do?
Yes.
What would be one of your first kind of treatments for her? If, let's say she's not dealing with acne or anything like that, just volume loss, the typical kind of aging that we're seeing in and around that age group. So anywhere between 50 to 55.
So without the injectables, in my experience, I feel like the best combination to give them an amazing result and to truly rejuvenate and renew the skin would be a series of micro needling combined with a series of photorejuvenation, which is an intense pulse light or a light-based treatment. Those two treatments together combined are going to address so many different skin conditions. So you're going to deal with the visible sun damage, so the pigmentation and the vascular damage, so the redness to the skin. The microneedling is going to re-stimulate collagen production in your skin, so you'll get brighter, fresher, more toned skin. So those two together for me are just like 1 and 1 equals 100. They just work beautifully together.
Yep. Yeah, I have to agree with that as well, especially the microneedling. I mean, you can see changes within like ages old of like acne scarring or anything like that. It's amazing.
Yeah. Yeah, and to touch on the photo, sorry, go ahead.
No, go ahead.
Oh, I was just going to touch on the photo rejuvenation. Just this year alone, I had many, many clients come in with aging concerns, a lot of visible sun damage, pigmentation, vessels, and unbelievable results with even just the series of photo rejuvenation, to the point where they're not wearing foundation anymore. They just can't even recognize their skin because they're so happy with how even and tone it is. The downtime is there, and it's not the most comfortable procedure to have. It is quite warm, but they're just ecstatic. Even after the first 2, they see such a huge result.
So that kind of goes into my next question. So if you did have somebody that came to you who had, major sun damage, so a lot of hyperpigmentation on the face, so you would turn towards going towards like a series of like photo rejuvenation with them.
I would, yes. As long as I visibly did the assessment and concluded that it wasn't hormonal pigmentation, because I would not treat that with intense pulse light or heat, then I would absolutely recommend a series of 5 photo rejuvenation. We space them anywhere between 3 and 5 weeks apart. You have to commit to 5, and some people need a 6, depending on the amount of damage, because the damage is not all on the surface. Our skin is layered, and a lot of the damage is between the lower layers of the skin. So we need to draw up some of that excessive pigmentation, and especially the vascular layer, which is a bit deeper. It takes a few sessions to really hit that layer. So it's certainly progressive, but you have to commit to a series.
Definitely. Yep. So what age do you think that somebody should start thinking about like skincare to help start to fight the age, to start to fight anti-aging, I guess? When should they start thinking about using like proper skincare? And I know it's kind of variable, but what would be your guesstimate?
Yeah. Well, my number one skincare product in the world is sunscreen. So that is from baby time. However, as an adult, if you're in your 20s, then be religious with your sunscreen every day and exfoliate your skin and use great moisturizers. Then when you hit your 30s, you really need to start using your active. So vitamin C's and things that are really going to stimulate the skin, because the skin will, as it's aging, it starts to regenerate as quickly. So my best advice is sunscreen from the earliest age you can. And then in your 30s, really start thinking about serious skincare and consistent skincare, because that's when you're going to start noticing signs of aging popping up.
Okay.
Yeah.
And are there some, what would you kind of suggest? Are there some lines that you would suggest individuals use over others?
Well, to put a blanket over everything is a little difficult. There's a million product lines out there. I can speak to the product lines that I recommend personally, and I've researched and I've chosen to partner with. For instance, Viviarma, that is our top skincare brand. It is a pharmaceutical skincare brand because the ingredients are active. They will work. They treat the skin and they will have an effect on the skin. Brands that are sold, in my opinion, now I'm just expressing my opinion, but drugstore brands, department store, a lot of the brands that are on Sephora, they're not as active, because if you can go online and just choose any product to use, it's not going to have a high level of efficacy, because if anybody can choose it and use it, it's not very specific to your own skin concern or condition. That's when you have to get really serious with the product you're buying. Go get a professional recommendation from a skin therapist. Assess the skin, know what skin conditions you have, what skin type you have, and choose the appropriate ingredients for that. And I say ingredients because the ingredients are what's important. The product is what they're delivered into to give you the result. So you need what ingredients you need to use in order to get the results you're looking for. And it typically is in a pharmaceutical or a clinical brand.
And that's a good point, because we hear so much about Sephora, for example, and people going there and spending, hundreds and hundreds of dollars on product. And
I'm a product junkie. I admit it.
I know
love
you
product.
are.
I love the fun stuff. I do. I am. I love product. But listen, I do go on Sephora. It was one of my favorite brands is Body Line, and I can't get enough of it. So I order that all the time. But when it comes to what I'm going to use in this real estate here, it's going to be pharmaceutical. It's going to be active. And I know that the studies and the science is backing it up. So that's where you have to get serious with your skincare. And I don't mean to sound preachy. It's just with my years of experience, I know what works and doesn't, and what ingredients will work and what won't. So you just get some professional advice. It really will save you money in the long run. And I want to speak to that. A lot of people will buy product after product after product because they're not seeing results. usually it's because they haven't gotten the right advice to what they truly need to be using, or they're spending $200 on a jar of face cream at Sephora, and really what is in it? Pretty packaging, some good marketing, some ingredients. So what I'm trying to say is, if you invest in the right product, it doesn't even need to be a lot of product, you will see a result because you're using active ingredients.
Yeah.
Yeah, I'll just add to that, Kerri. I'd love to add to that. There's a reason why there's a reason why pharmaceutical and medical skincare companies partner with medical clinics like yourselves. And the reason why is we use a lot of actives in our ingredients. So like if the wrong product gets to the wrong patient, some of our products can be quite dangerous. So the reason why we choose to put our products in medical clinics and not in places like Shoppers Drug Mart or Sephora simply is we need people that are well educated to be talking about the product so the patient gets the right product. The other thing is when you go to a place like Shoppers Drug Mart or Sephora, you're generally dealing with, say, Susie, who was on frozen goods on Friday. She was at the checkout on Monday, and she's filling in on Tuesday morning in the beauty section. The education just isn't there compared to a medical aesthetics clinic. So I think that's a very, very important thing we should touch on tonight on Skintox. And while we're touching on, I'd love to know your ladies' drink of choice tonight. Well, I'm having a beer.
Prosecco.
I'm having a beer from Big Rig.
I love Prosecco.
Yeah, this is a local Ottawa brewery, so I'm shopping local in Ottawa here. It's actually owned by Chris Phillips, who's a former Ottawa senator. What are you having, Andrea?
Nice.
I'm having a little bit of Grey Goose and some just sparkling water with some raspberries. Make it look fancy.
Yum.
I love it.
I always have my Prosecco.
Yeah, I hope everyone at home having a nice isolation drink at home and enjoying themselves. And I'd just like to bring up some photos. I know Andrea Cicconi's having a few drinks tonight. She was texting me before, so I'll just bring up photos, Kerri, just that you can speak to here. So the viewers can see if you can talk to these. Can you see them?
Absolutely.
So tell us about these. Yeah.
So those are just to show a couple of examples of some in-house treatments. The hands is showing a hand treated with photo rejuvenation or intense pulse light, and a hand that wasn't. So you can see how it specifically targets the pigment and the overall unevenness of the skin. And look at the radiance and brightness that is left behind. It is truly a remarkable treatment. And honestly, again, I said, one of my absolute favorites. The other is before and after of acne. So when it comes to acne, and certainly to this degree, oftentimes when a client would come in with this level of acne, you need to be looking at treating the skin internally and externally. So to properly achieve a result like this, you need to get taking internal supplements. We have a line that is called Skin Acumax, and if you take that daily, it can really help to control the oil production in the skin and also help to deal with the underlying hormonal influence. The other factor is the skincare that has to be used at home. You can't treat acne aggressively. You have to be gentle. Look at how inflamed the skin is. So we take it slow and have a lot of patience. And over time, the skin with light peels and the right calming anti-inflammatory products with a lot of antibacterial elements to it, the skin will start to normalize again, produce as much sebum. Acne is one of the most difficult conditions to treat because a lot of clients lose their patience with it and they'll just skip to another product line. It can take up to a year to really affect the skin, especially in treating acne. And Andrea, I know you've suffered with acne and we've worked together on that as well.
Mm-hmm. Oh, yes.
So that one is an absolute amazing, just to know you have to treat it internally and externally in order to get the best result. And it definitely requires a consultation because everyone's skin is different.
Mm-hmm.
Awesome. So let's talk body
Yes.
contouring now, Kerri.
I'd love to.
When body contouring first came out, I was one of those people that was a little bit skeptical about it, but now I've had a lot of experience in the industry, not selling any of the products or devices or anything like that, but seeing results and
Yes.
seeing results from a lot of clinics around the country or around North America. I'm a big fan of now body contouring and some of the devices and products that are out there in this space. I'd love to know, what's your approach or your sort of favorite approach to body contouring, and how does it look for a patient?
Well, my absolute favorite approach is, first off, proper client selection. I can't speak enough about that. I think a lot of these procedures over time have gotten a bad rap because they have been used to treat the wrong patient. And in the hands of the educated person with the right equipment, you can have amazing results. So body contouring, to me, you need to pick the right client because we're dealing with contouring the body, which means treating specific areas of fat that are like immune to diet and exercise. So if you're too weight, I'm just going to be very honest, if there's a lot of weight to be lost, body contouring is not for you. We're looking at treating patients who have a normal body weight, but just those little elements and little spots like tummy, arms, that just are having a hard time losing with diet and exercise. So again, client selection is the utmost of importance.
Awesome. Now, how important is the patient's commitment to the cause in regards to the journey for body contouring? Like, I'm talking about things like nutrition and fitness, as well as the treatments you're doing at the clinic.
Well, they all work synergistically, right? So a lot of clients that come in and come to having cool sculpting done, they are already fit. They are eating really well, and that is their frustration. Is that they're doing these things, but they're not seeing results in the areas that they're concerned with. So that's a portion of the clients. The other clients, once they commit to having a series of cool sculpting done, and it's not just one session, it could be 2 or 3 depending on the area treating, but they'll adopt a healthier lifestyle because they're investing in this treatment and they really want to see the maximum result. And that would be with a healthy lifestyle, eliminating the sugar, don't eat the junk food, eliminate the processed foods, and start moving your body. They'll get the best result that way. So I see both. I see people with the lifestyle and people who start adopting it, knowing they're investing in these treatments to give them the desired outcome. And that is with what they're doing at home and what I like for them.
Cool. Okay, so say I come in for a consultation, I'm a patient, and I'm the perfect candidate for body contouring. Give people some expectations of what they should expect. How many sessions would I need to come in to see you, and how long would I need to commit to say your clinic to get the perfect outcome?
Okay, so I never say that there will be a perfect outcome because this is medicine and we don't know. I mean, we don't have a crystal ball, but experience tells us, studies tell us that we can remove up to 25% of the fat in any area we treat per treatment. So depending on how much pinchable fat is there, I've been doing this almost 10 years now, so I can usually gauge and tell. So you're going to about 2 treatments. We space them 3 months apart because it takes a full 3 months to see the result. So we do the treatment cool sculpting in our clinic. I've never been trained on the other modalities, so I know there are others. So I can only speak to what I do. And, it's usually a journey of about 6 months. And you have to be patient with this. you go home and you see yourself every day, and this is a slow process of you know, the fat basically kind of working through the body, and you just need to be patient with it. But typically it's about a 9-month journey. So yeah, one treatment's never enough typically.
Awesome. So let's have a look at a few before and afters, so you can sort of talk the viewers
Yes.
through some of these before and afters. So we've got some here. Talk us through these.
Yeah. So this is one of my clients, patient, and this was after one session. Now,
Wow.
mind you, that's one session, but we treated multiple areas. So we treated her upper and lower abdomen. I sculpted her waistline, and I treated her flank area. So this is 3 months later after her first.
Wow.
She didn't lose a lot of weight. She did clean up her diet somewhat, but not a lot.
Yeah.
And this was the result of the cool sculpting after one session. Yeah, the waistline is spectacular.
Awesome. Okay, so
that's my story, guys.
It's okay. We're in isolation. It's either a baby or a dog. So
I know he's a funny little dude.
He's excited that he's on the second episode of Skintox.
He is. He's super excited. I don't know. He heard something.
Yeah.
So I'll speak to the picture of the back. Yep. So that is basically one treatment that's this patient needed. And we specifically treated the back flank waist area. So I did 4 spots to really whittle in the waist, a little bit of pinchable fat on the waist. She absolutely, and you can tell there was zero weight problem there. She's not overweight at all. She just had some pinchable fat that was bothering her. And the client with the side abdomen, this was a very young girl. She was 21 years old. She's a professional volleyball player. She couldn't have a healthier lifestyle. All she did was live in the gym and eat well, but she had this lower belly fat bothered her. So this was after one session. And we actually ended up doing a second session because typically if there's a little bit of unevenness after the first session, you have to go in and do a second because there's still some residual fat we need to treat. So all very successful outcomes for sure.
Awesome. And Kerri, just talk to us, like say someone was to come into your clinic to do cool sculpting. How long does it normally take for a treatment session?
So if they're having one area treated, let's just say the lower stomach, it's about an hour and a half long treatment that starts in and out the day. If they add on a second area, then we could be looking at 2.5 to 3 hours. I've spent anywhere up to 7 hours with a client in one day, depending on how many areas they want treated. I like to actually, though, work by treating only 1 or 2 areas at a time. Let's get those to your expectation and your desired result, and then we can move on. I don't like to treat arms, stomach, thighs at one time because, you know, clients may not see the best outcome after the first, and then they say, well, hey, I've spent a lot now. Why would I invest more? I didn't see a great result first time. Well, that's because you need a second, and some people need a third. So let's just start with 1 or 2 areas, get those the perfect way, spend your money there, and add on areas as you want. A lot of my cool sculpting business is repeat business not because it didn't work, because people add on more areas. They love it. It works so well for them because we're choosing the right people.
Awesome. Okay, that brings us to our section of the night where we're going to talk a little bit about pricing and medical aesthetics. And I would love for you to talk about the back end of medical aesthetics and actually what goes into these services and technology and these products that basically gives us our price. Because people are often saying that, oh, this is too pricey or what have you. But talk to us a little bit about the back end so it's easier for people to understand why things are priced in a certain way, please.
So absolutely. I mean, we look at a lot of different criteria. So let's start with the cost of the equipment itself. So the equipment cost and the consumable cost, whether it would be using a laser or cool sculpting machine or the or Botox fillers, you know, they come with a high price point, and because they're high quality products. The other side of it, and very important side, is what is the education behind your practitioner? So what education have they gone through? How much have they invested in the education? That means that you're getting the best result possible. So for me, education is key. How much experience do they have? You know, especially with the treatments that they're on, that should be really the first question a lot of people ask. And the price point basically does reflect that, you know, the time spent. So some of these treatments that we do can take an hour or 2 hours. So there's so many different factors that play in, but those for me would be the top three: the time, the education, and the cost of the equipment and consumables that we need to use to provide the service.
Awesome. And then I'd like you to speak to the people that like to shop around for to get the best price. And I'd like you to talk to the risks associated with that and the risks associated of that when they're trying to get the best possible outcome. And I want to show the viewers a photo here that will help you explain that. So
Absolutely.
Can you see that, Kerri?
So this one would be more for injectables, which is what Andrea and Dr. Van Aert would provide. I do not provide injectables. I'm not a nurse nor a doctor. Or look at how intricate the biology is, and the veins, and you know, all of the nuances that happen in the skin, the structure, the muscles, everything. Imagine that is covered with skin. So they actually are going in only seeing the skin. They can't see this. So their education tells them where these nerves and veins are in order to properly place the product into those areas safely. I don't know if I did that explanation justice, Andrea, because this is your expertise, but this is where the price point comes in. These injectors know where bones are, where to inject, where to avoid, and you're going to get a safe procedure. So that's the first thing you should ask, is not how much per unit is Botox, is what experience does your injector have? What is their education?
Absolutely.
Do you have anything to add there, Andrea? 100%, right?
You hit it right on the nail. It's exactly what the questions that need to be asked especially when you're doing something like injectables, because a lot of people don't understand the risks that are involved with it. They just kind of see the before and afters, and you know, that's, if your injector is also not going over, and that's a good point we'll make, is that if your injector or your medical esthetician is not also telling you the risks that are involved, then you have to be questioning that as well, because that goes part and parcel with the procedures that you're having done, especially at a medical level. There's always risks with those type of procedures.
Okay, I've got a question.
I think oh, sure.
Sorry, keep going, Kerri, and then I've got a good question that we'll answer. But you keep going. What you're about to say.
Yeah, just speaking to what Andre was saying with you know, the expectations and potential side effects. Yes, this is medicine. Any treatment that has integrity to it, or is an injectable, or we're using equipment for, again, this is and we can't always predict the outcome. We can, because of our education, we can provide you with the safest treatment possible so that we can mitigate those bad outcomes that sometimes a non-educated person would be at higher risk to basically, you know, have happen in these procedures. Like, I've been performing laser for oh gosh, I did my laser training in the year 2000. So yeah, it's 20 years. And I'm going to tell you, it's not a regulated industry in this country. You could hire anyone off the street and train them to use your laser. A lot of people don't know that. So ask the experience. It's so important.
I'm just gonna kick myself off the screen.
Okay, he's putting up the question banner now.
So
that's
what
a good
do you
one.
think is better, fat? Yeah.
So I'm and Andre has worked with me a long time, and I'm a very honest person. Okay, so I have we do have cool sculpting for submental.
Mm-hmm.
With cool sculpting, you have to be the right candidate. It has to fit in a very perfect way because you're attaching an applicator to the submental area. And if you don't have the right anatomy in order for the applicator to affix properly, cool sculpting is not the best for you. Also, if you have too much submental fat, I would always basically have you speak to our physician, Dr. Van Aert, or another physician if you're in another province, because Belkyra actually can be injected and placed specifically into that fat zone, not necessarily requiring the applicator to affix to it. Either way, you're dealing with multiple treatments on either side. So with submental, you're dealing with 2 to 3 sessions spaced 3 months apart. And with Belkyra, Andrea, how many sessions typically? 2 to 3 as well, or even more?
Sometimes more, depending on the amount of submental fat there. Yeah, absolutely.
So
but both treatments are permanent.
It's not what I think is exactly. Yes, when the fat cell is gone, it's gone permanently. So to me, it's not about which is better. It's which is better for you, and that is where the consultation comes in. So I have referred a lot of people who've come to see me for submental cool sculpting to the doctor or to Andrea for Belkyra because cool sculpting was not good for them.
Yep.
So I hope I answered your question okay.
Perfect. That's the beauty with Belkyra is that we can just, that was a great question. Yeah, that's the kind of beauty with Belkyra is the fact that we can kind of get it in there in spots that where with your cool sculpting, it's that fixed fixed machine here.
So I to myself personally, I had Belkyra. I only had 1 session. I probably need more because my face and the anatomy of my bone structure didn't lend well to having a cool sculpting treatment. So for me, it was just the injectable and specifically fat pad just worked so much better. So again, it's up to the consultation and the practitioner giving you the right advice as which treatment would be better for you.
Yeah. Good question.
And sometimes it's liposuction, to be honest. Sometimes it is surgery. There's a lot of things we need to take into account. Is there too much skin laxity present? You know, sometimes if you remove too much fat, the volume, even though cool sculpting can tighten the skin, it is an on-label treatment for the submental area. If there's too much redundant skin, it's just not going to give you the desired outlook. So it's so important to know all of the different facets of what is going on and what you're not liking. I've had people come in for submental fat cool sculpting, so under the chin, but in all honesty, it was just a lot of loose, redundant skin. It wasn't fat at all. Yeah.
Cool sculpting could make it worse, not help, and you know at that point it's more like a lower neck lift or something like that you're looking at.
Yes.
Okay, I've got another.
And you know I've never been in the business to sell anything. I don't believe in selling things. I believe in recommending appropriate treatments for your skin concern. And if it's not something that I have that will give you a result, I'm not going to treat you. I'm going to advise that you seek another opinion, possibly with a surgeon, or to go see Dr. Van Aert or yourself, because I know what I have isn't going to give you the result. So it takes a lot of, again, education, but also you have to develop an honesty with your clients and your patients, because not everything that you offer is going to be for them. You want them to get a good result. Why offer a treatment that you know they're not going to get a result from? It just doesn't make sense to me.
Awesome. Now I've got one more question, and this comes from New Zealand. It actually comes from my mum, and I want you to talk to this, Kerri, because I tell my mother to wear sunscreen all the time, and she doesn't listen to me.
Yes, especially down there.
Maybe she will listen to you. So I'm gonna come out of the conversation again, and I'm gonna put this. And I want you to tell my mum how important sunscreen is.
Okay. Us oldies.
Older than 60.
Yeah. Well, you know, you're never too old to start wearing SPF, especially if you live in a climate where UV is very prevalent. Even in our climate, I recommend using it 24 or 365, 24/7, because you have to always protect your skin from the sun, especially even inside, because UVA passes through glass, and that's the aging ray. So you're never too old to start. However, if you have a lot of sun damage, you may want to look at having a treatment like what we started our conversation with, a photodynamic therapy. Try to get rid of some of that underlying sun damage. Start wearing sunscreen. It's never too late. You know, the sun is so damaging to skin, and the least of our worry is aging. You've got to worry about skin cancer. That is something that I've seen some horrific, you know, outcomes in people who've had portions of their removed because of a cancerous lesion, and that's just that's not worth it when you can use a cream, a beautiful product, because today's sunscreens are absolutely lovely. They're not like in the past where they're thick and white and pasty. You can get some gorgeous products, and you just have to use it every day. So I say there's no excuse, and you're never too old.
So if you're out there, Mum, and you're still listening, please listen. And all you other mothers out there,
start wearing it
as well, and wear your sunscreen.
Yes,
yeah.
Wear your sunscreen.
So thank you so much for joining us tonight, Kerri. It was absolutely awesome to have you on the show. Next time we catch up, though, we have to catch up in person, and we'll be having another beer or wine.
Yes.
I can't wait.
Cheers, guys. Thank you so much.
Yeah, I can't wait to be out in Halifax again with the Truro Vibe and Vitality girls and the teams out there. And thank you to all the viewers for tuning in. If you want to get hold of Kerri,
thank you so much.
Yeah, if you want to get hold of Kerri, at Kerri_Vibe Medispa, or pop into the Vibe Spa in Halifax. And if you want to get hold of Andrea or myself, Andrea is at Nurse Andrea Inc. Is that right, Andrea? I think it is.
And Andrea Nurse Inc.
I'm sorry, at Andrea Nurse Inc. And I'm at Feel free to reach out to us if you have any questions, and we will get back to you as soon as we possibly can. And if we don't know the answers, we promise we'll reach out to a professional in our industry who will get the correct answer for you. And it doesn't matter where you're around the country, we will point you in the right direction to a clinic that will be able to help you out with your concern or your issue. So thank you, everyone, for tuning in. I'd like to thank my co-host, Andrea, on this side. And down here, I'd like to give
Nathan.
Thank you.
We're going to do another show during the week.
Nathan.
Catch you later.
Thanks, guys. Cheers.
Good night, guys. Bye.